The Joint Task Force on Enforcement of the Tobacco Control Act in the Gambia commenced exercises to monitor and enforce the 2016 Tobacco Act. The task force, consisting of representatives from the Ministry of Health, the National Environment Agency, the Gambia Revenue Authority, and the Gambia Police Force, conducted inspections across several businesses in the Kanifi municipality. Shops, supermarkets, and other commercial outlets were checked for compliance with the provisions of the Tobacco Control Act. During these inspections, officials seized illegal tobacco products including banned cigarettes, vapes, and scissor flavors. The senior program officer of the non-communicable disease unit under the Ministry of Health, Saifo Singate, noted that public compliance with the display of tobacco products in the Greater Banjul area has significantly improved. However, he emphasized that challenges remain, particularly with the sale of single cigarettes.
To enforce this provision, so enforcement is compliance will be high in the next 1 or 2 months, but after that you will see it start dropping again if they don't see enforcement officers around the areas they are. This is human nature, but overall we can say there is marked improvement as far as compliance of the overall act is concerned. But we will say with regards to display of tobacco products, we have seen a marked improvement. That is rarely seen, tobacco products seen at points of sale being displayed, even though we have some pockets doing it here and there, but it's at a very minimal level. Open stick selling is what we still have in some challenges. Before it used to be very high, but right now we realize that from yesterday, today, and last week in the provinces, we realize that it is gaining momentum again. A lot of these vendors are still selling in single sticks, but we will try to address the situation.
He noted that since the law enforcement began, they have made several arrests, but prosecution efforts have yet to be achieved success.
Enforcement is a process that is going to continue, and we cannot just rely on the enforcement officers only. That is why we are using a multi-stakeholder approach. We are trying to get as many stakeholders as possible. Just last week, we have a nationwide engagement, a regional engagement with religious leaders, and that is Christian and Muslim Council, and influential leaders in our communities to also join the fight, to put it in their sermons, to address some of the provisions or some of the sections of the act in their communities, where they come from, because we cannot have our enforcement officers in all these places, but our religious leaders are there. We also have engagement with shopkeepers, we have engagement with students. All this is to boost enforcement. All this is to make sure compliance level is high. And this we are going to continue doing. This enforcement process is going to continue. And since we started the enforcement of the act, we made several arrests, and they were taken to the police stations. We are not successful with prosecution yet. Since we started, there is no prosecution, but we are just applying some leniency here and there. We address them, we caution them, and advise them to follow the law.
Mr. Singate called on the public to join the fight against tobacco in the Gambia, stressing that the public is not responding the way they should as far as the act is concerned.
Gather all information surrounding tobacco products in this country. Before you go into the business, come to the office. We give you all the required regulations. You go and follow this due process. The law is also there. The Tobacco Control Act is there. Those that are selling these products, let them make sure they follow strictly what is in the act. This is what we want to advise. And the general public to also support, because they are everywhere. The shopkeepers are in our communities. They are in our society. We live with them. We sleep with them together in the same house, in the same. If we see them violating these provisions, and you know it is something that is contravening the law, tell the person, please, what you are doing is against the law. The law says you are not supposed to display, and you are displaying. Please put it down. If the person refuses, then you can call the police to come. But you don't have to wait for the police officers to come and say, this guy has been doing it, even though it is banned, but you have never taken any step to address the situation. This is the challenge we are facing. The public is not responding the way they should as far as the act is concerned.
Awadiba, a public health officer at the Sarakunda Health Center, described the monitoring exercise as successful.
Our job is to supervise, to go with them, make sure that they are doing the things right, they act according to the act and the public health standard. So we make sure that things that are not illegal, we try to confiscate them, or we advise them to not do it, or give them like a warning side style. So yeah, so we've been there with them, trying to make sure everything goes well. We supervise them, we make sure everything is going according to what it is. And yeah, so far so good. It has been going well, and we have seen some of them, and we have warned them, and then some of them are coming to the police station with us. So yeah, it was going very well.
The Tobacco Control Act passed by the Gambia government in December 2016 officially came into effect on December 17, 2018. It introduced key provisions such as restriction of smoking in public places and the regulation of tobacco advertising, promotion and sponsorship. The act also banned the sale of tobacco products through vending machines and online platforms, as well as in schools, stadiums, healthcare facilities, cultural centers, places of worship and other designated locations. Reporting for Kirfatu, I am Ramatulai Jao.